let's do a different version of one that we've done. So what I'm going to ask you to do, come in so that this band is pressing against the hip. My right leg is on the outside. The right leg is really the working leg in this case, and then we'll turn around and we'll do the left. But basically what I want to do is I want to push into it to stretch the band. If you can put your foot there, awesome. If you can't reach there, that's fine. And then come back out. And what I'm trying to do is load this, but don't let it slingshot you out of there. Try to control the motion. So we're using the non-surgical leg first. Start even a little closer. So bring your right leg in closer, even closer than that. Yes.
It's already trying to
I know.
slingshot me.
That's it. And then come back. Perfect. Let's do 10 of them just like that. So in an exercise like this, like we're generating a little proprioceptive feedback through the non-surgical side first. We're building some confidence. That knee has a significant amount of crepitus and problem already, the non-surgical knee. So if we can improve the ankle and we can improve the hip, we can also unload some of the forces going through the knee. Now we'll work the surgical side. So the support leg is the leg that's really working, even though the non-support leg is the one that's moving. It's really no different than if I put a band around the ankle, just a different place to add resistance. How does that feel?
Okay.
Can you feel your hip burning a little bit?
Yep.
Good. That's what we want.